So, Namaskar everyone. My name is Dr. Manish Yadav, and I welcome you all for this interesting talk. Now, today's talk is very interesting and it is very close to my heart. It is always said that we should always keep going to the basics whenever we are in difficulty. And it is very important and crucial that we should keep on evolving and refining our basic skills. And as a homeopath, when we talk about refining basic skills, one of the pillars, one of the pillars of homeopathic practice is understanding Kent in depth. And when we talk about Kent, we always talk about Kent's repertory. So today, what we're going to talk about and discuss, rather, I am going to share with you my understanding of Kent, which I understood from his lesser writings, from his practice, and the way people understand Kent, and the way what Kent has actually written in the lesser writing. So I'm going to do a series of lectures, starting from Kent repertory first, then going into the lesser writings, and also talking about some research papers. We will try to explore Kentian approach in practical terms, not in theoretical terms, but in practical terms. Now, in my practice, generally in my practice, a lot of time people ask me that which repertory are you using? So initially I would use bigger repertories, but I had a lot of difficulty in using these bigger repertories because the remedies used to come the same. Whenever I made a totality, the same remedies would keep on popping up. So I understood. What I felt is that maybe this kind of repertorization is more mechanical now. And then slowly and steadily, I came in contact with Kent. I got inspired by Kent. In fact, my inclination towards Kent repertory was my guru, my mentor, Dr. Sunil Mar Sarkar. People know him for his mathematical knowledge, but let me tell you, my friends, he is master of repertory, and especially the basic ones. So he taught me to use Kent, BBCR, Boger, Borek, and Nair repertory, and also to look into some finer repertories like Clark repertory and understand. So we will take slowly and steadily all repertories if possible. Let's see what's the God's plan. But today, I'm really excited about talking about Kent's repertory. Now, using Kent's repertory. Now, when I tell my students or tell my colleagues that when I make totalities, I don't use bigger repertories. I just make totalities only on the basis of Kent. And then BBCR is always there. Borik Fatak is always there. But first priority is always Kent's repertory. And they are all shocked many times. And they say, but Kent is not sufficient. We need bigger repertories. We need bigger this, bigger this. I don't face those problems. I don't face those problems. You know why? The reason is because what I understood about repertory per se is repertory is not a search engine. Yeah, sorry, it is not a research engine. It is a search engine basically. So you search there. It is not like you go and do inventions there, discoveries there, or you get you. It's not a solution provider. Repertory is just to give you a glimpse of group of remedies, and ultimately, our entire focus has to be on remedy. Whether we see single drug rubric, totality, the remedy. When a physician does his work, his case taking and analysis, and has in mind the remedy, the focus is remedy, then whatever totality you take, whatever repertory you take, it becomes irrelevant. So today, let us talk about Kent repertory. And whenever we talk about Kent repertory, for example, a student comes and says, I am very excited to learn Kent repertory. And you open any lectures or, they start studying or you look at the books, what you get? People always talk about mind rubrics because Kent has written, I think, 99 pages or something on mind rubrics. So they all talk about mind rubrics. This delusion, this means, this rubric, this means, the Latin worded from here, which is important, I feel, which is important. But when I started studying Kent from my practical purpose, hardly I take those rubrics. Hardly. Because those are, many rubrics are interpretative rubrics. I'm not saying that you should not understand those rubrics and terms and meanings. You should know it because wherever mental symptoms are there, it becomes higher value. But generally, to make totalities, it is very important to understand the philosophy of Kent. Before you open Kent repertory and put your rubrics into it, it is very crucial to understand the philosophy of it. Why he has written this big book? Why so much sub rubrics? So what is about generalization? What about the sub rubric, single drug rubric? What is the meaning of all those things? So let's Let's come, friends. Today we'll share something, and I will try to add value to your practice as Kent has added a lot of value to my practice. So let me open my PPT, and from there we begin. Any author, if you want to learn about any author, it is very crucial that you should go and read his lesson writing. We have got a lot of lesson writings. We have got Bogus lesson writing, Kent, Henneman, we have got Farrington, we have got Clark. All the people's lesson writing compilation has been done. So we should read that. So let us first read something from lesson writing of Kent, page number 312. Let us see what is he saying. He writes there, many of most brilliant cures are made from general rubrics. When special does not help, and in careful notes of 10 years, would bring down many of general rubric symptoms and furnish the best clinical verification. So what is he saying? He's saying that a lot of cures, brilliant cures have been made through general rubrics. So your focus has to be more on general rubric. So let me make you understand a little bit what is this general rubric. So let us go in Kent's repertory first. Let me open this Kent repertory. You can see here Kent repertory. If you want, I can just zoom in. Let's open any chapter. Let's maybe open nose. So if you see here, these are smaller ones. Qatar, let's see this. 171 rubrics. When you click this, you find lot of sub-rubrics, which has less number of remedies. Then post-nasal discharge, 57 remedies. You go ahead, any rubric you put, like tumor. These are sub-rubrics. No, this is not general rubric. Wherever lot of remedies are there, like pain, this is a general rubric. When you open this, you can see a lot of sub-rubrics, 6 remedies, 4 remedies, 5 remedies. Okay, let's open head. You can see plus sign. Okay, yeah, anemia of brain. Bigger rubrics. General rubric means bigger rubric, where you have got more remedies. See, head coldness, head sensitive to cold air. These are bigger rubrics where you have got maybe 20, 30, 40, 50 remedies. Congestion, constriction, 159, 173. Dandruff, empty sensation, enlarged sensation, eruptions. If you click any of them, you will find lot of sub-rubrics. You go to mind section. You see absent-minded, 111. If you click here, you get so many sub-rubrics. Any rubric, abusive, 22. You get so many sub-rubrics. Striking, get this. Oh, staring. Let us see staring. 91 remedies. You get so many sub-rubrics. Striking. 31 remedies. So many sub-rubrics. So what is he saying? It is Kent, na? He has put those sub-rubrics, right? But he's saying, no, don't repertorize sub-rubrics. Don't take sub-rubrics into totality. And he's saying that basic cures, like brilliant cures, have been come whenever this general rubrics have been used in totality. What does that mean exactly? We will try and understand it step by step. So if you understand this part, it will help you to use Kent repertory in a very easier fashion. Then there's a section in lesson writing where he talks about how to use repertory. I'm not going to talk in depth about it because I would rather want you to go buy that book and start reading it. Because when you read, from your perspective, you understand a lot of things. But I'll just give you a glimpse of it. Here also he says, after full case is taken, after you have taken full case, single out all the expression that describes the general state. So first take the full case, then you single out all the general symptoms, the general state. Now, what does this general state means? What is this general rubric? Okay, but what is this general state? So then he gives the examples of general state. What are those? All aggravations that happen at local level or general level, all aggravations are general state. All ameliorations. So take amelioration, take aggravations, longings for like mental or physical longings, company desire for, mesmerization, rubbing, all those rubrics which are there. All desires and aversions, physical ones like craving, aversions, you have to take. These are general ones. Antipathies and strong dislikes. Like you'll find some rubric, hatred, hateful, okay? Aversion towards a sight of people, strangers aversion from. Those are likes and dislikes, and strong antipathies. Fears. You'll see a lot of rubrics like fear of dark, fear of ghosts, fear of men. Those rubrics you have to take. All the fright and fear rubrics. Intellectual perversions, methods of reasoning. You'll find a lot of mental symptoms where rubrics are like memory weakness, comprehension difficult. So those kinds of stuffs you have to look. And last, he says causes of mental disturbance. What are the causes? Like there could be anger, there could be insult, there could be hurt, there could be disappointment. What are the causes? There could be grief, there could be maybe, suspiciousness, so many different mental causes. And then he comes and says, unless the symptoms that characterize the patient brought out in the record, the physician should not be surprised for failure. Means he's saying if whatever symptoms you have got, if those symptoms do not characterize the patient, then he should always think of failure. The remedy must be similar to symptoms of the patient as well as the pathognomic symptoms of his disease in order to cure. The remedy, whatever you're giving, has to be similar to the pathognomic symptoms of this of his disease in order to cure. Now, what is pathognomic symptoms? There is something called as pathognomic symptoms, and there is something called as pathology. So definitely, we are not talking about. He's not talking about. He's not generally talking about disease names like cataract, paralysis, or those stuffs. But he's saying pathognomic symptoms. Those symptoms which are pertaining to the pathology. What is happening to the pathology? Let me give you an example. I said paralysis, but let me make you understand this. Homeopathic practice is not given in terms of disease diagnosis. So somebody comes and says, give me a remedy for gallstone. Give me a remedy for cirrhosis. No, not for that. But qualifying character in that. So pathognomic symptom is talking about the pathology, but not the disease name. Let me explain you this part. When you read Kent's, go and read Kent's lectures, any remedy you pick up, any remedy, maybe conayam, asteria, pick up lacasis, belladonna. Your understanding of remedies might be all mental symptoms and all thematization. But what are they talking? Like suppose if you pick up belladonna, what does he talk about? He talks about acuteness. He talks about congestion. You take conayam. What does he talk about? He talks about the paralysis, how it happens at mental and physical level. You talk about asteria. You take lilium technicum. You take sepia. While he is describing the remedies, he is also describing what is happening in pathophysiology, the sphere of action that's happening. You pick up phosphorus, you pick up lacasis. What are they talking about? What is he talking about? He's talking about how it affects the nerve, how it affects the blood, how it affects, goes and destroys the bone. What is this? These are pathognomic symptoms. So, my dear friends, when people say that Kantinian approach is all mental symptoms and trying to understand only in the mind, the delusion, the best meaning of the rubrics. No, my dear, it is not like that. Somebody will ask, then why are you talking? You're talking about all general rubrics, and why did Kent write sub rubrics there? Why so many mental rubrics? My dear friend, it was a book. When you have to accomplish any article, you have to include everything. But when you include, because it has to be a comprehensive work, it is a comprehensive and great work. So if everything is written there, but what is Ken doing? In my maybe second or third lecture, I will take you to a research paper where you will see what Kent has done in his practice, what Kent taught, what people understood, and what actually Kent did. There's a lot of disparity there. I'll take you through. I will take you through the process of Kentian understanding why he started talking about intellect, guilt, and all those things. But when you come to the practical part of it, what was he doing? How to use Kent in our best way? Practice basically. So you have to characterize and you have to become master of remedy. Why I'm spending so much time on this slide is the symptoms has to match pathognomic symptoms. In my practice, whenever I select any remedy by any method, I will tell you the fact that I will never give the remedy until I will read mud remedy, because ultimate judge is mathematical. I am using repertory because maybe because my mathematica is not that strong enough where I can just differentiate 10 remedies in my mind and give. I'm using repertory so that my work becomes easy. But ultimately, Allen's keynote preface, if you open the first paragraph, what he writes, the life work of a homeopath is to continuously comparison and differentiate. You have to comparison, differentiate. That is the life work of a homeopath. So ultimately, I have to become not master of repertory, but I should become master of mathematica. Repertory, once you understand the facts, you start using it. It's like mathematics, you keep on doing it very easily. There's nothing great in understanding repertory. That's what I feel. Real work is understanding the remedies. So we have to read a lot of remedies. Then you will start thinking in terms of remedies, and repertory just becomes a bystand and the supporter, which will help you or aid you. And it will be very easier for you to shift from one repertory to another repertory if remedy is not matched. People look for rubric matching. I look for remedy matching. Suppose I take a rubric and remedy. Meserium is there, but meserium is not matching. The symptoms are not matching. The pathology is not matching. The mind symptom not matching. General state not matching. Miasmatic traits not matching. I will throw out that rubric and remedy. I will look for another rubric, another remedy, because remedy is a center that has to match. Get this point. I have told you something very important in your practice. Very important. Now let us understand through a case. I will also show my cases, but let me first pick up a case from Kent's lesser writing itself. And whatever he talked about general symptoms, talked about pathognomic symptoms. You have to characterize. And what is he talking about? Like how to use the repertory. So this is a very good example. This patient comes, he's got cramps in the fingers, and the hands, arms, all three. Okay. Sometimes sensation of paralysis in on and all of the three. Sometimes tingling, numbness in one. It is not on, it is one. In one or all of them. Brought on from writing or while writing. So, sorry. So if you say here, you get location, you get sensation, and you get aggravation. What is the location? Hands, fingers. What are the sensation? Cramp, paralytic sensation, tingling, numbness. And you definitely have elements from or aggravation from writing. So writing is the cause. Now you just look into the repertory and you take the rubrics, right? Kent extremity cramps handwriting. Aggravation. Kent's extremities cramps fingers writing while. Kent's extremities numbness handwriting while. Kent's extremities numbness fingers writing while. Kent's extremity paralysis forearm sensation while writing. Extremity paralysis hand sensation while writing. Cramps wrist writing. All writing rubrics and all the sensation is taken. You feel this is the best way to repertorize in this case? Definitely. This is how we would repertorize. Because in the sub-rubric, when you go, exactly it is given. Cramps writing, numbness writing, paralysis writing with the location. But when you repertorize and you come here, what happens? Look at it. Which remedy are you going to take? Don't you feel when you repertorize sometimes or many times this kind of sheet comes in front of you? For me, this is how sheet used to come earlier. What's the remedy? Now, on your whims and fancies, you will repertorize and give your remedy. So, what's the right way? Same case. He says use general rubrics. Don't use sub rubrics. He says use general rubrics. So, what is a rubric? Kent cramps, extremity cramps fingers. Take those rubrics where more remedies are there. Okay? Don't go deep and sub rubric. Extremity cramps hand. Paralysis hand. Paralysis finger. This has less remedy. And that writing, when you see writing rubric, when you want to search writing rubric, aggravation, 6 remedy, 4 remedy, 5 remedy, it creates a lot of confusion. So generalize it. Don't you feel it looks like BBCR? Because Boger, Bonninghausen, Boger also talked about the same thing. Bonninghausen's approach, generalize it. Yes, it is similar. When I come to Boger, maybe I have posted few lectures of Boger. How Boger was a person who actually used Kent and Bonninghausen together. So he was a disciple of Kent. Okay. But he was impressed. Boger was actually a student of Kent. But he was too much impressed with Bonninghausen also. So he was a person who took Kent, the entire layout of Kent, and he used Bonninghausen's approach of generalization and made BBCR. That is why BBCR is such a wonderful repertoire. We will talk about that again in some of the lectures. But I already have posted about Boger's synoptic key and its understanding. You can go and read that lecture. So look at this repertory totality. So simple: sensations taken, locations taken, and generalities, aggravation generalized. Now what happens here? Don't you think it becomes easy for you to now find a remedy? What is the remedy? Which remedy do you think you should give to this patient? Remember, the remedy has to characterize the patient, means the general rubrics. And once you find the remedy has to match the pathognomic symptom, not the disease symptom, but the pathophysiology, what is happening, that sphere of action, it is to match. The remedy is plumbum. You can go and read now. Let's read in Boric what is written. Paralysis of single muscle. So we know plumbum is a very good remedy for paralysis. Wrist drop. You can see a lot of wrist drop. And if you read, cannot raise or lift anything with hand, extension is difficult, paralysis from overexertion. Writing. What is writing? It's exertion, overexertion of external muscles like piano players. Writing is also same thing, right? When somebody is playing piano, okay, and somebody is writing, it's the same thing. And pains in muscles, coma in paroxysm, wrist drop, cramps, twitching, tingling, numbness. This is another problem, that we want everything to repertory. Now, somebody will say, you have not taken twitching, tingling, numbness. I will take few general rubrics. The remedy which comes, I will look into Mathematica. Mathematica, those sensation symptoms are there. I don't need to form totality. Remember, repertory is just as an aid. It is an aid to go to into few remedy differentiation and find out. So when you say tingling, numbness, it is just a part of the pathology, pathognomic symptoms. So you have it is being written here in Mathematica. So when it is written there, then paralysis, everything is written. Now you find everything to be written. So the remedy that was given was plumbum metallic. Right? So I hope this case helps you understand the mistakes that we do in our practice. This is the problem when people use Kent repertory, they use all sub-rubrics and they fail. Then they divert from there. That's why, you want to use the bigger ones or, all messed up things. No, you use proper general rubrics. I will do a lot of case examples and show you. Now, let me show you a case from my practice. This is a case of conjunctivitis. Okay. So, let us see the case. Allergic eye since 2 years. Comes and goes. This guy says, I get allergy in my eyes. Since 2 years, it's coming and going, coming and going, coming and. What happens? There's a lot of redness, itching, swelling, pain around the eyes. Describe the pain. Pain appears gradually, remains, and then gradually disappears. Redness, I could see, you can see a lot of redness there. What is the sensation there? What do you feel? A lot of burning. What else? Can you tell me more symptoms? I'm very sensitive. He says sensitive to all kinds of lights, sunlight, artificial light, any type of light. My eyes can't tolerate. What do you do to for a relief? Apply cold water, because when I apply cold water, it soothes the pain in the eye is better. I'm very sensitive to light and get irritated. Now, when he was talking about aggravations, suddenly he said, "You know, doctor, he talked about light and this and cold ameliorates." Then he says, "I am very sensitive to light. I get irritated." What is this? Now, from local, he has gone to global. When somebody talks in terms of I, my hand is paining, my hand is paining. Oh, when my becomes I feel the pain too much, then that is a general symptom. So basically, what he's talking about, he's talking about a general symptom. So when he said general, so what I said is, let me go deeper, and this is the right time to go into the mind symptom. So I asked him, tell me about your nature. Anger is too much, doctor. Describe the anger. He says, like, driving. While I'm driving, I follow all the rules, but others don't follow the rules. I get so irritated, I can't tell you. I said, tell about this. Anger is sudden. There is sudden outburst, and then it gets calmed down quickly also, but there is sudden outburst in anger. Egoistic. Now he says I am egoistic. So whenever patient says I am egoistic, now you should never take a rubric egoistic until you qualify. You know, he say I'm egoistic. Maybe I'm egoistic a lot of. So I asked him, what do you mean by egoistic? No, my self-respect should not come down. Insults I can't tolerate. I'm very sensitive. The time he talked about this, and he talked about anger, insult, respect, my mind suddenly went to a remedy. You know which remedy? Staphysagrin. Now, this is the problem when we are not, when we don't use repertory properly, then whatever whims and fancies and whatever likings and dislikes of remedies we have, that remedy pops up in in our mind. And it is absolutely impossible to not think of a remedy when you're taking a case. But now let's see how we go. Staphysagrin, I have definitely not given staphysagrin to this patient, but I was tempted to give staphysagrin, but I have not given it. And thanks to Kent, it saved me from there. Tell about insult. Self-respect is very important, doctor. Rules should be followed. Okay. Wrong things I can't tolerate, like throwing things on road. I can't tolerate that. I said, tell me about your sensitivity. You said you're very sensitive. What are you sensitive about? Oh, doctor, I'm very emotional. I get emotional very easily. A lot of things affect me very easily. Like movie, I become sentimental, I cry. Pain and suffering of others, I can't see. I feel for them too much. So, it's talking about sentimental, emotional, sympathetic towards others. These are his mental symptoms. Remedy you can suggest. And my dear friends, to tell you, like, this is a case, the entire case I'm showing. But as the case was being taken, before I went into the mind, already I had repertorized. I had already repertorized the local symptoms in a general format, which I will show you. So I had few remedies in front of me, which I was thinking. Right? I just had to differentiate them and see which one is matching. Craving for spice. Okay, so what we do is that I will take those rubrics here. Now, general rubrics, remember that, general rubric. So, eyes redness, 162 remedies. Eyes inflammation, 133 remedy. Eye pain general, 190 remedy. Of course, this should not be here. It will be in the next slide, but by mistake, I took it here. You can skip this. Eyes photophobia. Photophobia, artificial light, sunlight. I can combine this entire photophobia rubric. I can combine and make it one. Eye pain general, cold water ameliorates. So you can see this all general rubrics. Then I started adding mental symptoms. So if you see here, before we go to the mental symptoms, if you see here, I've taken only general rubrics. So what I did is I followed Cantinian advice and said, you take general rubrics. You take general rubrics. Why? Because when you take general rubrics, you will get a group of remedies in front of you. Then next you can apply differentiating factors, like you can use mental symptoms as eliminating symptoms. You can use mater medica to differentiate and then give it. That is the crux. That is the utility of Kent repertory. And this is the way Kent repertory has to be used. Sympathetic mind. Anger ailments from. He has anger now. So if you remember the general state when he was describing, he said, take the causes of mental disturbance. So anger, mind ailments from. Food, spices, condiments, highly seasoned food desire for. And then, of course, the remedy was very clear to me. Then there were some few questions of generalities I asked. A lot of desire for cold water. And one more thing he was doing, like this. Cold water, it was getting ameliorated, but he always was doing like this. Not pressure, but it was rubbing. So I generalized it. Rubbing ameliorates. Pain appear gradually and disappear gradually. And when I repertorize, this is the repertory sheet which opens in front of. Now I have got phosphorus, arsenic, sulfur, aconite. Now my role is only to differentiate between them. Then I asked few more questions, confirmatory questions. He said, I have too many friends. Yeah, very good communicator, love talking, very loquacious, craving for cold drinks. And the remedy that was given was phosphorus 3201 m. Purposely, I'm not able, I will not be able to show you a video because it's a video, patient's privacy reason. But after phosphorus, I think for 2 months, yeah, he came after first month he took the medicine, second month he had a telephonic call, third month he just came for his father's because his father was also my patient. He had actually forgotten that he has also taken the medicine. So I had a video, I have a video recording of that. He says since I started the medicine, the entire redness, swelling, everything went off. And I am very easy. At all levels, he started improving. The emotional level, the physical level, the pathology, everything got better. You see how simple it becomes? Let's see more cases. Because if I keep showing you cases after cases after cases, you will be able to understand what I'm trying to say. Not I, but basically what Kent is trying to say. Case number 2. This was an acute case. I had a telephone from a distance place, and she said, Doctor, I have got throat pain and acute headache. Okay. So my previous 2 prescriptions had failed because it was a telephonic call. And sometime I did some prescriptions, but it failed. So she called me on the 3rd day. Doctor, my headache and throat pain is not relieved. Now, you have to understand that this lady has already taken allopathic medicines also. But this throat pain and throat pain was not going. So now when I failed 2 prescriptions, I said, no, I should take the case properly now. Because it was phone consultation. I just prescribed something on phone. So I called her, I recorded the entire case, and this is how the symptoms go. This is a very interesting case because the remedy that I gave in this case with wonderful result, this remedy I wouldn't have been able to even think in this acute because I manage acute in and out every day. But this remedy I wouldn't have thought giving it in acute if I wouldn't have used Kent's philosophy and used proper generalization and rubrics. So let's see. Headache started again, doctor. What happens? What's happening? Too much weakness. I have too much weakness after I work in kitchen in the morning. Okay. Too much pain in throat. Headache is there. Throat pain is very severe. Throat feels as if scrapped. This coughing is so much that it feels as if my throat is scrapped. Left side pain. Throat pain, especially motion when I'm moving the throat, like talking or something, swallowing, or slightest cough. Since when I'm coughing now, then pain is intense. Like this, if I'm silent, no problem. When I'm coughing, pain is intense. And then she says, I have got pain around the eyes. Now, this was very interesting. Concomitant type. She says, I've got throat pain, headache, but my headache pain is here. My this entire eye socket, Initially, I thought she's talking about sinusitis. No, it was not sinusitis. She says, my bones are paining, doctor. These bones, now, this eye socket, all these bones are paining. So now this was very strange. So whichever remedy I choose, the remedy should have these eye socket also as the pathognomic symptoms, the symptoms of the medicine. Head heaviness. I'm not getting sleep. Day before yesterday also I woke up at 3 a.m. Now, acute diseases, remember this, aphorism number 5. To treat acute, you always need exciting cause. There is always an exciting cause. Without exciting cause, there is no acute. We are not able to find that is our mistake or maybe patient mistake. Majorly, it is our mistake because in our case taking, we are not well versed, not trained to go back and find out the cause. So I know this fact and I look for exciting cause always in acutes, always. So I was trying to figure out what is the cause, like why she is getting so much pain. So I understood that there is a lot of loss of sleep episodes happening since past few weeks and yesterday night also. She's not getting proper sleep. So lack of sleep could be. I'm not saying maybe, it is. I'm saying it could be one of the factors of one of the cause, exciting cause of her headache, throat pain, and socket pain. Not even in a day, I'm getting sleep, doctor. Night 2 a.m., 3 a.m., I woke up. Oh, doctor, this pain is there, but this weakness, what to do? See, the case when started, it started with weakness. Oh, I feel a lot of weakness in my legs, a lot of weakness in my body. So, exhaustion, physical exhaustion is also a part of this remedy. These are the certain components which has to be there. So, what is happening in the weakness? Because of this weakness, now my legs are trembling. Legs tremble when I stand. So now I need a remedy which has got the pathology like the symptoms of throat, the eye socket, the cause, headache, the cause like loss of sleep, weakness, and what kind of weakness? Trembling of extremities. The best way would be, which whatever method I come, I should go and read the Materia Medica and all the symptoms that is given should be written in the Materia Medica. If it is written 110%, the patient is going to get better. There is no option for the patient to get better. It is only when our Materia Medica does not match with the remedy now, there is a problem. Desire open air. Continue. Hurried in morning after waking. Morning I have to wake up and make tiffin for children. I'm always in a hurry. Okay. Pain, nasal bone, eye socket, up to ear, facial bones, all the articulation joints. That's what I wrote. Articulation joints are affected. Pain between left eye and eyebrow. I feel lot of rawness. Then I wanted to ask the sensation. Now, what is she feeling? Burning, pricking, needle-like. She says it is scrapped. I said, what is scrapped? She said, raw. She said, छिल गया पूरा. हिंदी में छिल गया पूरा. Rawness. Cough is not great intensity. She says, my cough is not of great intensity. But rawness is so much now that even slightest little cough causes so much pain. I can't tell you. So the problem is not cough. The problem is rawness. Now comes Kent repertory. Now, so many remedies we can think of. Maybe the best way, if you want to understand this and learn, what you should do is that my humble request would be that you should pause this video right now. If you're watching this video, just pause it. Go and open your Kent repertory. Go back into the PPT and see the case. You have seen two cases. Now, plumbum case I showed you, phosphorus case I showed you. Now you go and repertorize. You have all the symptoms. Repertorize and see what comes. If you just keep watching the videos of mine or anybody, it is not going to help you. You have to work by yourself. So you have seen the case, go and work, come back to the video, and then match what was the understanding. So let me go further and show you what I did with this. So first thing, I took throat problem. So pain, throat, raw, no subrubric, only general. Rawness, coughing while. Now there's only 14 remedies, but I just took it because I could discard this also. If my remedy does not match, I could discard it. But this was so important, na, it was characterizing the pain. What she said, the rawness is so much that even slightest cough is causing problem. So I found this remedy, this rubric very important. And I found it. So I took it. Maybe 14 remedies. Head pain general. Head pain is there all the way. Okay. This headache which she has, headache and articulation pain and headache she has, I got this rubric, late hours of loss of sleep. That's it. That's it. So ideally, what I'm doing is that you might be thinking that I take the case and then repertorize. No. As the patient is saying, and I find the right rubric, I'm just repertorizing. I had taken only these 4 rubrics: rawness, coughing, head pain, and the cause. Other symptoms I have not taken. Means she talked about so many other things, the weakness, trembling, articulation. I have not taken. There is no need to take it. That is the message that I want to give. Sometimes we are so stuck up in a case that everything patient says, we want, like in this case, now articulation. You will take eye socket also. You'll take, like in other phosphorus case, I showed you such a big rubric, but it was all general rubric. I want Kent says reduce to going to particulars and sub rubrics. Reduce that. So when I repertorized this and I was taking the case, this is the sheet which came in front of me. Only with 4 rubrics. Argentum, not nitricum, it is metallic. Carbovage, nux vomica. Nux vomica. I was thinking of giving nux vomica because loss of sleep. But nux vomica, when I read, it has got different pathognomic symptoms. It doesn't have brain, articulation, joints affected, trembling of limbs. It has got more of gastric trouble. This patient was not having that. And there is no wrong, though it is in rubric, it is there. You will say in rubric, it is 3 marks rawness. It is there. But generally, when you look at nux vomica read, things will not match. So I discarded Carbovage. Now, Argentum metallicum. Now, this was very interesting for me. So I went and studied the remedy. So I wrote down, what does my remedy need? This is very important few things. My remedy should have left-sidedness. Bones articulation. Cartilage is the seat of action in this case. Neuralgic pain. Exhaustion. Rawness 3 marks. Trembling of lips. And when I read Argentum metallicum, look at this. Look at this, what is written. Left-sided pain. Chief action is centered on articulation and their component elements, bones, cartilage, and ligaments. Headache, neuralgia pain over left side. This patient was having a lot of left-sided complaint and neuralgia. Head, pain between left eyebrow and frontal eminence. And extremities. See what is written here. Leg weak and trembling. When I saw this, these 4 components and those 4 rubrics, I was completely done with the case. I said, if Argentum metallicum will not help this patient, nothing can help this patient. See, this is the beauty of Kent Repertory. It is so simple. It is so simple. When you use Kent in this fashion, it is so simple. And then, of course, it has always to be backed up with Mater. I always read Mater. I will not maybe repertorize everything what patient has said, but I will definitely keep reading Mater and matching the remedy which poppins. I will match it in Mater and read from especially Boric, Fatak, or Allen's. So I've got a lot of follow-ups, but I don't want big privacy issue. I don't want to show it. She got absolutely better. Absolutely better. I've got subsequent follow-up, like 1, 2, first day, second day, third day. Her acute went off, headache went off, cough went off, pain went off, everything went off. Okay. Now let's go to the third case. So till now we talked about general symptom, general symptom, general symptom. Now some question might be coming in your mind that why the hell he made that sub rubrics? He wrote those sub rubrics. I gave you the answer because he wanted to compile a book, right? But it doesn't mean that sub rubrics are wrong. The only thing is you should not try to make a big totalities out of sub rubrics. When you make a lot of totalities out of sub rubric, the repertory sheet in QPROM, the first sheet, that is a situation which is going to come to you. Another case, acute headache. I have audio, I have whatever cases I'm showing you, I have got all the follow-ups, the initial new case and all follow-ups. So in person, when we do a lectures, I definitely show them. But online, I don't want to show it any of the audio or video faces of patient because of privacy issue. Audio. What she said. She's my old patient. See, a lot of my chronic patients, they don't take allopathic medicine because they know if they call to homeopath, to me, their acute is going to be settled. That is the secret of practice, actually. She called me and she said, right side headache. Doctor, my right head is paining so much. Oh my God. I said, what is happening? She said, it's paining from here, vertex, location, exact location she gave. Vertex, and it goes down, 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 down to the neck. I don't know what kind of pain this is. Severe pain, doctor, severe pain. Anything else other than that? I've got a lot of gastric complaints, a lot of irritation, flatulence, my stool is not okay, burping is there, all gastric complaints were there. So I started looking at it. Now, when you look at this, that's the case, done. No other things. Now she gave me something very important. Such a good symptom of vertex to neck, so specific. So what is the cause in this case? Now let us find out. Acute disease, it's a headache. Cases of headache, but it is not a headache case. It is headaches are many a times headaches are reflex symptoms. Means some other organ is affected because of their disturbance, headache comes in. And especially gallbladder, liver, when they are affected, and they have a lot of gases and gastric acidity or flatulence, stool discomfort, portal circulation problem, headache comes. Maybe sometime uterus problem and headache come. Yeah, because you have got rubrics. Reflex uterine disease from reflex. You just put a word reflex in your repertory, in your rubrics. You'll see so many reflex symptoms. So it was not a headache per se. It was a referred pain. Means the seat of action of this remedy, this patient was gastric complaint. So I needed a remedy, which the best would be I need a remedy which has got pain from vertex to neck, like that. That characterizing symptom has to be there, but that remedy should have a very good known action on liver. There's only two things I was looking for. So I've been saying don't use single drug rubric, but here I used single drug rubric. I went and started looking into the headache and opened vertex. Then I went down, Kent, head pain, localization, vertex. Then I looked into subrubric, extending to neck. It was so specific. Now you see here, single drug rubric. Kent says to make totalities, don't use single drug or 3-4 rubric, 3-4 remedy rubrics. Then your sheet is going to be haphazard. When you get something very characteristic like this, then you look into the rubric and look into those few remedies. So I looked into these remedies: calciraphos, chelidonium, glonine, and calmium. You know the choice is so simple now. Now, out of these 4 remedies, which is the remedy which has gastric complaint and very good action on liver? It is chelidonium. So I gave chelidonium. I gave it in potency now. Now, generally we give it in mother tinctures. But here characterizing symptom was there. So I gave it in potency. I gave 200, then I gave 1 m. Immediate relief. As I gave next day, night she slept. Next morning she called, doctor, I am absolutely fine. There is no headache. My gastric complaint is better. Everything is settled. Patient happy, I am happy. So right side headache, vertex to occiput, gastric complaint, irritation. So when you look here, I told you, don't give any remedy before reading, even if you know. So I opened and then I saw this in Chelidonia. Head pain, right sided headache, down behind the ears and shoulder blade. All the symptoms that you want to prescribe, look into Matre Medica. Always keep Matre Medica on the side. Never prescribe a drug. Whatever your repertory says, never prescribe a drug until and unless it is written in your Matreya Medica. Okay. Now, word of caution. Particulars. Single drug rubric. Okay. So be aware of, it's not about good or bad, but be aware of when to use particulars and when to use generals. Ideally, when you're forming a big totality, Kent says the best cures have come from understanding of general rubrics. You have to generalize. In his lectures also, he generalizes. He's not saying paralysis or he's not saying, one symptom like blood affection. He generalizes all the symptoms, like when you read the remedy. So particulars, use it with caution. Single drug rubric are like two-edged sword. Single drug rubric. Nair is a very good repertory where you have got a lot of few remedies or single drug rubrics. Boric also has. Clark also has. It is two-edged sword. So if you want to use single drug rubrics or few drug rubrics, like we used it here, 4 remedies were there in that vertex to neck extending pain head. Use it with caution means look at the remedy, match with Matre Medica. Look at the remedy, match with Matre Medica. Read Matre Medica. If it matches, don't make any totality, just give. But if you want to make totality, do it on your risk if you want to put these rubrics into picture. I'm being telling you. So this is a repertory lecture, but I'm telling you, Matre Medica has to match. You have to become master of Matre Medica. Yesterday only I was having a talk with one of my very close friend. He's a homeopath. Very, very brilliant homeopath. So while I was discussing, I was talking to him about Kent and I told him that, we should read Kent more, means the lectures. The lectures, Matra Medica, we should read more, not the repertory more. Repertory, you learn once and twice and it is done. Then it is just practice in your clinic. But constant work should be on Matra Medica. And he asked me, why should we keep learning Matra Medica? I said, there is something very nice written in Kent's. I don't know which remedy, but it is written somewhere I had read. I have somewhere I have noted down. He says that if you want to increase your skills of case taking, your observation skill, your understanding skills, read Matra Medica more. More you read Matra Medica, more your senses and your understanding opens up. See, when you read Matra Medica, different things come to your picture, your mind. The subconscious catches it. And when the patient comes in, clicks. So people ask me, oh, I want to learn rubrics. I want to learn which rubric here. I said, don't worry about rubrics. Why are you worrying so much? Read Matra Medica, different remedies. More remedies you will learn. More deeper you go into the Matra Medica lectures, your understanding, acumen, everything is going to be better. Okay, so Matra Medica has to match. Especially bold and italics for the basics to start off with, bold, italics, and underlines. You should always try to look for bold, italics, and underlines. Whatever patient says, it should be written in bold, italics, and underlines. This is what I learned from Dr. Sunilmar Sarkar sir. This is what he was doing, and one of my teachers, which he was my old teacher, but I met him in the COVID time, Dr. Dinesh Gupta. Dr. Gupta sir, when I learned from him, this is what he imprinted in my mind. Always used to say, look into bold, italics, underline. And since then, I started looking, and then I can't tell you, how good my practice is. Right? Symptoms of patient has to be written in MM. One last case of sleeplessness. I got this patient, and this patient was having sleeplessness since 2 years. Can't sleep. It was a phone call. Don't get sleep whole night. He was a student actually. Sleep only for 6 to 7 a.m. Well, I sleep after 6 to, like morning he sleeps till 12 o'clock, but night there is no sleep. and studies are affected. Anxiety attacks, panic attacks, low confidence, no other data available. No other data available. Now, what to do? So I started exploring the sub rubrics. He would just not give any history, any history. As it was a phone call, I don't know why he was not talking. I don't know what to do now, but I have to give something. So I started looking at sub rubric, other rubrics. Sleeplessness. I just went deeper and deeper and deeper, below, and then I found this rubric: sleeplessness, sleepy all day, sleepless all night with body aches. Staphysagria. It exactly matched staphysagria. And you will not believe, empirically, I gave staphysagria. I said, okay, I'll give him. Sometimes what to do? I just gave him. Follow up. I have a follow up audio. It was magic. He started sleeping in the night. As he started sleeping in the night, he started attending his lectures and studies and everything, confidence and this and that, all those things, everything improved. And then when I got a follow up, I said, oh my God, how is this possible? If staphysagria has worked, definitely he was a staphysagria patient. So in my White is Remedy Act. So it was not a particular single drug rubric. Actually, it acted because the patient's mental picture, the genius matched with staphysagria. So in follow-up, I asked him some direct questions about insult, anger, all those aspects, masturbation, sexual thoughts, everything came in. And then I understood, oh my God, it acted because the remedy was right. Are you there with me? Yeah. So this this case I just showed you because to just make you understand that when a single drug rubric you are taking, your remedy has to match. Now, in this case, I was very lucky that it matched. But if he was not a staphysagria state and another patient comes and says, whole night I don't sleep, day I am sleeping. If I give staphysagria, it will not work until the genius has to match. So in reverse order, whenever you are wanting to give any remedy, single drug or less, 3, 4 remedies in a rubric, remember this, it is two-edged sword. Read Mathematica, match the mental picture, the physical generals, and then give. Okay, so ultimate guide is Mathematica. Now we come to a very important article that's written there in the lesson writing itself: artistic use and mechanical use. Repertory, when we're using repertory, many times it becomes very mechanical. Just patient is saying, we're just putting everything. Patient is saying, we're just putting. Patient is saying some incidents, we are just analyzing and putting, interpreting and just want to find the rubric. So what does he say about this aspect? So he gives an explanation about through a case. What is the meaning of artistic use and mechanical use of repertory? Mrs. S, age 47, very excitable, almost hysterical woman for many years, has suffered violent occipital headache, compelled to take strong medicines for years, occurs every few days, never passes a week without one, continues for 3 days. Heat pressure give most relief. Bowels constipated for week, no desire, then take cathartics. Says, I have taken everything. Stool hard, small, resembling sheep dung. Craves open air, cool air. Heat flushes. Menstruation absent lately. Urine scanty strong. Eyes have sensation that they do not belong to her. Cold knees, below knees. Coldness of knees and below elbows. Very tired and excitable. Oversensitive, extremely sensitive to touch over the entire body. Now, so many things she has said, so many things. If you just keep on putting into repertory, everything what she said, heat flushes, menses absent, coldness, everything you start just putting, your repertory sheet is going to show you all empty boxes. So what is artistic repertorization? Let's learn from. What it Ken said that once the case is taken, get out all the general state symptoms and then put it into repertory. So characterizing the symptoms. So strange, rare, and peculiar. What is strange, rare, and peculiar? You first find out that and that you put into general rule. So two things. Strange, rare, peculiar means characterizing symptom, and then generalization. Two formulas. Stool. So he focused on stool. The problem is in the stool. No? He focused on stool. How's the stool? Balls like. Stool, small. Sheep dung like. Hard. Rectum, inactivity. There's a book. Yes, luckily I have it on my desk. So I don't know if you can see this, but I will show it in the end also. What the doctor needs to know in order to make a successful prescription by Ken. It is a very small book. I don't know, maybe 50, 60 rupees, less than 100 rupees, this book. Okay. I can see this, right? What the doctor needs to know in order to make successful prescription. There are different chapters in this book. I know because of the background, I'm not able to show you, but there's a different chapter. In every chapter, he's actually written how to take the case. Like suppose a patient of heart complaint comes, how to take a case and how to explore it and which rubrics has to be taken. So after this, my video, I think you should buy this book and start reading it. It will give you a lot of wisdom in your case taking. What about headache? Localization, occiput. So if you see here now, let's go to the stool. All general rubrics. Headache, occiput, jarring, aggravates, pressure, ameliorates. All general rubrics. Heat, ameliorates. Modalities, which were the modalities? That was generalized. Cold air, desire for, in generalities. And when you repertorize this, Nux alumina comes, but the remedy magnesium muriaticum comes. And now you read magnesium muriaticum. So magnesium mur was given. It is a liver remedy, liver with pronounced characteristic constipation, chronic liver affections. So though we have taken stool symptoms, but what he said in the last PPT, before PPT, what he said, two things to focus now. Not this PPT, the initial one. He said characterize the symptoms and pathognomic symptom means from where it is coming. Why his stool is black, sheep dung. It is not stool problem, it is liver problem. So you need a remedy for liver, not for stools. Right? Like in the headache case I told you, I need a remedy for liver. So that is called pathognomic symptoms, or knowing the pathophysiology or what is going around, which area is affected, the sphere of action. Okay. Bowels, stools, naughty, sheep dung like. Okay. Yeah. So now we are done with this. So this was about Kent. So let me summarize it. Kent is a wonderful repertory. Your practice will help you a lot in your practice if you use properly like this. Now, this lecture is ended now. Whatever I had to say, I have said. I've talked about whatever factors I have understood till now, and I've been using it in my practice. And of course, I'll be making more videos on Kent and bring up more cases and cases. Basically, the best way to learn is through practical cases. Theorization is not important. So I will show you, depict you more cases where I've used Kent, and from there you will go further and try to understand. But now once you end this talk, if you really want to make complete use of this talk and enhance your clinical skill in your practice, lesser writings by Kent, please pick up, start reading it. Specific chapters you can pick up and start reading it. The book that I talked about this book, get it and start reading it. And from there, we'll go ahead and definitely we'll meet again. Do write to me, write your comments, your questions if you have. And I hope this lecture makes a lot of sense and it helps you in your practice and to grow and become a better physician. And so that we all cohesively take homeopathy to the next level and help a lot of patients who are suffering outside. Thank you very much. Namaskar. Bye bye.